We now come to the fourth oral question. Baroness Andrews.
My Lords, I beg leave to ask the questions standing in my name on the order paper.
I call the Minister, Lord Bethell.
My Lords, we have made our supply chains more resilient by massively expanding both our supply from overseas and our domestic manufacturing capability. We are now confident in our supply of PPE to meet the needs of health and social care over the next 7 and 90-day horizons and are looking further ahead. We continue to model future demand from health and care services to cover the approach of winter and to bring resilience to the supply chain.
Baroness Andrews.
My Lords, the government is being warned on all sides, urgently warned, to prepare for a second wave of COVID this winter. Last week, and I hear what the Minister said, last week the Public Accounts Committee found that government was still not treating the supply of PPE with similar urgency. Will the Minister now commit to publishing a detailed plan by September, as the committee has asked, to explain exactly what is going to be different, so that mistakes are not repeated and health and care workers are better protected?
My Lord, I completely share the noble Baroness Andrews' concerns about the second peak, and we are working on this, preparing for that. And I do respectfully accept the views of the PAC and would like to emphasise that our approach to PPE is incredibly serious. Huge amounts of work has gone into it and a huge amount of progress has been made.
Baroness Browning.
Friend, then identify what lessons have been learnt so far from both the quantity and the quality of PPE that has been used in homes and hospitals? And would he also say what action will be taken to minimise cross-infection from those people who have to go into people's domestic homes and who often work in more than one location?
My Lords, the big lesson from COVID is that the quantity of PPE needed for a disease like this is massively more than you could have ever expected, particularly more than our experience in the past. And that has hit every country around the world and has hit the global supply chains incredibly hard. A benign lesson is to find that British manufacturers are capable of stepping up to the challenge, and I salute their work. In terms of the contamination from itinerant workers, this was always one of the greatest challenges of the care sector, and we've put in a huge amount of work and financial resources to avoid the need for workers who move from home to home.
Baroness Cousins.
My Lords, when I asked the Minister on the 24th of June to ensure that interpreters in the NHS wouldn't be forgotten when stockpiling PPE in case of a second wave, he very helpfully told the House that he would continue to press the department on this. So I'm mystified that I still haven't had a reply to my simple question of the 12th of May, asking who is responsible for providing PPE for freelance NHS interpreters. Is the Minister able to enlighten me today?
The noble Baroness Cousins is entirely right to champion the role of interpreters. And may I just add that the role of interpreters in the recent Leicester lockdown has been incredibly important, and there couldn't have been an incident that highlights the importance of language skills in the healthcare setting, for which I pay tribute to her championship. In terms of the care of interpreters, this is an incredibly complex question, and it entirely depends on where those interpreters are cited. It would be the responsibility of individual trusts to look after the interpreters in the setting of hospitals, but in other settings it may be other organisations.
Lord Rooker.
Now accept that there's no further excuse for secret, non-competitive contracts for PPE channelled through the friends of ministers and special advisors. There are thousands of UK companies ready and willing to bid for contracts to produce PPE in the United Kingdom. Why not use them? and China may not be reliable in the future?
I completely reject the implications of the Noble Lord's question. Whilst British companies have stepped forward, and we are pleased to have made many contracts, it is not the case, I'm afraid to say, that there are thousands of domestic producers who are capable of meeting the billions of items that we need in the British Health Service. I pay respect to all those companies who moved quickly and contracted under difficult circumstances for major contracts. And I also salute those companies overseas with whom we have good relationships and remain our trusted partners.
Yes, Brinton.
My Lords, alongside PPE, we must have a comprehensive test and trace system to prevent a second wave. Today, the Health Service Journal reports that virtually all the top team of test and trace are leaving, and that McKinsey's are contracted to review the governance and entire form of test and trace. Why would the government bring in a multi-million-pound consultancy to review a so-called world-beating test and trace system?
My Lords, the turnover of the team at Test and Trace is an inevitable consequence of an organisation that was put up using temporary staff, many of whom are on short contracts and need to return to their previous roles. It is regretful, but I owe them a huge debt of thanks for the work they have done. The work of McKinsey is focused on governance, not on HR. It was commissioned some time ago, and it is an entirely proper and regular appointment.
Baroness Thornton.
My Lords, can I refer back to what the Noble Lord said about the amount of PPE which was needed? It is actually the case that in the 2016 report, it was signalled that we would need a gigantic quantity. I'm sure we'd all agree that we need better organised and effective preparation if there's to be a second wave, and centralised purchasing of PPE managed by local public health agencies will ensure effective distribution. I want to ask the Noble Lord about the care sector. Does the Noble Lord believe it's acceptable or wise for care homes to have to pay over-the-top prices and compete for PPE? Does this not put wider public health interests at risk? And what steps is the Minister taking to end discrimination against the care sector in the supply of PPE and ensure essential protection for care workers, residents and visitors?
My Lords, it is a reality that the cost of PPE has gone through the roof. There's nothing I can do about it. There's nothing the government can do about it. And that is something that we're going to have to live with and budget for. It is part of the new reality. As to the procurement of PPE, as the Noble Baroness Thornton knows, within the care sector, it was previously the arrangement that local providers would source their own PPE. The government has stepped in to bring resilience and confidence to that supply chain and to offer alternative sources of supply to local care homes. And in that, we have moved emphatically and sought to bring both affordability and resilience to the supply chain.
Lord Dobbs.
My Lords, I was going to ask my noble friends about the private sector provision of PPE, but might I actually move on to something which is even more significant, perhaps, the hopeful news of developments in identifying a vaccine against COVID by Oxford scientists. Is my noble friend able to offer any update on that news, and could he set out what role the private sector has in the development and hopefully eventual manufacture of any such vaccine?
The Noble Lord is entirely right. The news from Oxford appears to be incredibly encouraging. Coronaviruses typically are very difficult to provide vaccines for, but the Oxford team are clearly confident that they are making serious progress. They have a contract with AstraZeneca, who are their private sector supplier partner in both the UK and globally. And the administration of that vaccine, should it be successful, or any other vaccine, should it be successful, is a matter of huge national importance. And thanks to the work of Kate Bingham and the Vaccine Task Force, we're putting a huge amount of work to ensure that the administration of that vaccine into the arms of the country will be done in a speedy and efficient fashion.
Lord Craig of Radley.
My Lord, The Noble Lord Dayton was appointed last April with much fanfare to resolve a national PPE crisis. Is the Noble Lord now responsible for ensuring adequate PPE for both full clinic and other type, particularly for care homes, to deal with any second wave and the expected higher numbers infected through winter months in the whole of the UK or just for England?
The Noble Lord is still, the Noble Lord Dighton is still in place. I spoke to him recently. The impact he has had personally is been immense, and I owe him a huge debt of thanks for that. He is particularly focused on the make leg of the PPE project, and within that he has recruited firms like Medicon, Redwood, Photocentric, Ramfoam, Elite, and McDonald and Taylor Healthcare, who are between them providing hundreds of millions of items of PPE from British manufacturers.